In the quiet corridors of our hospitals, behind the pale curtains and clinical lighting, something important is beginning to change. Something subtle but powerful, something rooted not in high technology or expensive machinery, but in a simple and profoundly human idea: connection. In Canberra, the Safewards model is breathing new life into the way care is given. It's not a machine, it's not a pill, it's a philosophy, a framework, a way to make the clinical feel personal and the institutional feel human. First trialed in 2021, the model has now expanded across 10 hospital wards in the ACT. And it's working, not through grand gestures, but through little moments. Names remembered, faces known, conversations held, because when a patient walks into a hospital, they are not only carrying an illness. They carry fear, confusion, vulnerability, and all too often, that fear can transform. It can twist into frustration. It can manifest as anger, sometimes even violence. But what if we could interrupt that cycle before it begins? What if the moment a patient steps through the door, they see not just a uniform, but a person? A person with a name, a face, a story, a favorite football team, a love of gardening, a sense of humor. That's what Safewards brings. It puts photo boards near the entrance, staff faces, names, and even their personal interests. Because when we humanize the caregiver, we de-escalate the room. When we speak with kindness, not just courtesy, we change the tone of the entire environment. Staff are trained not just to do their job, but to do it with gentleness, with care in their language, with warmth in their words. And that matters. It matters more than we know. Because language can heal or harm. A harsh tone, a cold phrase, a careless shrug, these can turn a nervous patient into a fearful one. But when a nurse kneels to eye level and says, "I'm here, and I hear you," something shifts. The walls come down. Clinical nurse consultant Leah Marshall has seen it firsthand. At North Canberra Hospital, she describes how daily visits by senior team members, not for paperwork, not for policy, but for conversation, have changed the entire rhythm of the ward. Every morning, they check in, not just on charts, but on hearts. They speak to patients, they listen to families, they hear concerns early, before they become complaints, before they become confrontation. And those small conversations, they have had a powerful effect. Complaints have dropped, tensions have eased, trust has grown. It's a shift from reactive to proactive, from distant to present, from system to soul. This is not about ignoring the tough realities of healthcare. Hospitals are high-pressure environments. Staff face trauma, fatigue, and stress every day. But Safewards offers something in return, a toolkit to help de-escalate, to soothe rather than inflame. And the result is not just fewer incidents of violence. It's more safety, more dignity, more calm. We must ask ourselves, why did it take so long to realize that kindness is not a luxury in healthcare, it's a necessity? Why did we wait to embrace the idea that a patient who feels seen is less likely to lash out? This isn't just a Canberra story. It's a lesson for all of us. In every state, in every hospital, in every ward where patients come not just to be cured, but to be cared for. Because care is not just about medicine. It's about presence. It's about eye contact. It's about listening before responding. It's about treating the person, not just the condition. In a world where healthcare systems are stretched thin, where staff are under pressure, where patients are anxious, Safewards reminds us that the most powerful tool we have might just be empathy. It reminds us that small actions can have a big impact. That knowing a nurse's name can calm a racing heart. That feeling heard can prevent a crisis. That seeing a smile can soften a hard day. That a warm word can cool a rising temper. This is not sentimentality. This is strategy. It's evidence-based. It's been studied, tested, and now implemented. And it's working. We often talk about innovation in healthcare. We think of robots, data, algorithms. But this is human innovation. Emotional intelligence, institutional empathy, these are just as groundbreaking. Because a peaceful ward is not just a nicer place. It's a safer one. Safer for staff. Safer for patients. Safer for families. And when safety and compassion walk hand in hand, miracles can happen. It's time we look beyond the spreadsheets and statistics. Time we listen to the voices on the ward. Time we made space not just for treatment, but for trust. Safewards shows us a better way, not a perfect way, but a kinder one. A way where the system bends toward humanity. A way where a nurse's presence means more than a prescription. A way where the first thing you see when you walk into a ward is not fear, but familiarity. And maybe, just maybe, that's where